On this episode of Pathways, we're stepping into the high-stakes world of the operating room.
Upstairs in the main OR, 8, 12, up to 24 hours straight going. Like I've done 23-hour shifts on my feet all day, all night. And you're just like round-robbing surgeons. Like, so you have an orthopedic surgeon, ankle fracture. Okay, I'll see you in 6 hours. I have 4 cases in front of you. I have a C-section to do. I have a couple appendixes to take out. See you when I see you.
Certified surgical technologists are the quiet force, making sure every instrument is ready, every move is precise, and every second counts.
Hello, listeners. We are back with another episode of Pathways, part of the Northern Light Health Healthy, Happy, and Wise podcast series. I'm your host, Emily Tadlock. Today, we are venturing into the operating room, chatting with surgical technologists Megan Pinkham and Diane Raymond. Thanks for being on with me, ladies.
Hi.
For having, making some time for me in your busy schedules. Holy cow.
Oh, absolutely. We ran over here. We're still in scrubs.
I was like, you look a little flushed. Like, whew, you guys must have rushed over. And it's getting warm out too, so that's helpful.
Yes.
Yeah. So I guess my first question for you ladies is, what in the world is a surgical technologist? Who wants to go first?
So I've been doing this for 15 years.
Oh, wow.
I know, right out of high school. I had a great time. So a surgical tech, you'll see it on TV. We're the people in the background. You don't see our faces that often. We're setting up fields. We're passing the instruments. On TV, most people see scalpel. We're the person with the scalpel passing the scalpel.
Oh, okay.
It's a lot more than that, but that's what it boils down to most of the time for people to understand what we are.
Okay, interesting. So for those people who don't know or want to learn, what exactly do you do in the operating room? Do you want to take that one, Diane?
Yeah, like Megan said, pretty much everything. We are the extension of a surgeon's hands to shorten it up. Like basically the surgeon needs something, they're keeping their eyes on the field, they're the operative field. And we need to pay attention to what they're doing. We need to hand them or anticipate what they're going to need next. If the field gets a little skewed because they can't see, we need to help give them a better field of vision, wiping any fluids that may be there.
I know we're trying to tiptoe around so we don't get people squeamish because
exactly. I mean, but that's part of the job, right?
It happens,
one of the things that I like to say is I like to keep it real.
Okay.
So if let's
the down the dirty but the PG rated.
Exactly. Yeah, that's exactly it.
So we're opening people up so that we can fix them, right? So we are going to see some blood, we are going to see some body fluids, and so we need to make sure they can see. We're passing them the instruments that they're going to need next to get the job done.
Okay.
So and
so they get 12 years of schooling as surgeons, give or take, depending on the specialties and what they choose. We went through the expedited program at Maine Med, which now I believe is a 2-year program. We went for 11 months. And we had to learn all of this. And now we have to anticipate the needs of the surgeon who spent 12 years learning it.
Wow. Yeah. Holy moly. So so talk a little bit about what schooling was like and what you both went through. Megan, if you want to start.
Yeah. So again, I did this in 2010, throwback here. And my schooling looks different than Diane's. It's been years. It was 11 months of wow. It's a lot. So like the first 6 months you're in the classroom and you're learning everything. You're learning all of the vocabulary, how to spell everything, how to say everything, every instrument, every body part. You're learning everything all at once. And you're going through sections of the body at a time. So there's give or take 9 different service lines. So you're doing feet, heart, lung, general, urology. And you just have to keep everything in your brain all the time.
What? Yeah. I mean, and you were just talking, Diane, about anticipating what a surgeon needs. How do you do that unless you know how to do the surgery? How do you anticipate what they need?
So
repetition.
Repetition and learning the steps. And so for me, I started this job only 5 years ago. So I decided that at 50 years old, it would be a good idea to switch gears. And prior to this, I worked in HR. So I decided, let's go into
so
the
different.
It
Holy
is.
moly.
It is. But for me, it was like, I feel like you're never too old to learn something new.
Absolutely not.
So I you know,
And that was common. And it's
yeah.
very common as a second career.
Really?
I had the youngest of my class, and in the history of their classes, we had 6 people at 18 years old.
Yeah.
Everybody else, it was on their second career. I had a teacher, a construction worker. This is just a good second career option. PSA, we need scrub techs.
Yes.
Yes,
Marcy's
you
always
do.
Yep.
It's a common theme on a lot of these podcast episodes that I do, that we are in fact also recruiting those types of careers. So why do you think that is, that it's such a good second career?
I think when it comes down to it, you want a change in life. And like when you go into healthcare, you're going to help someone.
Right.
So you get to whatever you were doing in the past, regardless of what it was, you're going to walk into the OR and you're going to help someone on the worst day you see them, which is the day they're going into the operating room to have surgery.
Wow.
Yeah. My career path was, I started as a CNA out of high school, and then I went into the insurance industry. I did medical underwriting. So I was reading the medical records of people who needed insurance.
Okay.
And then I ended up becoming a stay-at-home mom. And when I was ready to go back to work, I went back to work in the HR department at Maine Health. And they had this program, and I'm like, this checks all the boxes, because I was interested in healthcare and I really wasn't sure how I wanted to get back into it.
Right.
And so when I saw that this program was open to people who wanted to learn how to become surgical technologists, I was like, I think I want to try this. And the first thing my husband said to me when I brought the idea to him, he's like, do you think you're going to be okay, like at the sight of blood? And I'm like, we're going to find out, but
Right.
And that,
I'm like,
and some people who think they're okay aren't okay.
Exactly.
Yeah. It's not for everyone.
not for everyone.
not for everyone,
But you can come and see, and you can decide for yourself.
Yeah.
Don't talk yourself out of it.
And
Yeah.
I tell everybody that I meet that ask what I do, I'm like, this is the hardest job I've ever had, but it's the most rewarding.
Physically,
It's hard. Mentally, it can be hard. I mean, you're dealing with many different surgeons, many different preferences, because each surgeon, even if they're all ortho surgeons, they like things a little different. So that's the anticipation piece comes in. And in my past job, I've been with Northern Light now for almost 9 months. Yeah. And so I've learned a lot more ortho than I did before.
Okay.
Which I'm handling it. I'm doing all right.
Getting the
coming
hang of
around.
it.
Yeah. And so Megan's an awesome teacher, just so you know.
Oh,
she was my
thank you.
mentor and
Look
my
at that. That's so great.
Yeah.
So not only are you a surgical tech, but you could do a specialty.
Yeah. So let's subspecialize here.
Okay.
So I am an orthopedic surgical technologist.
Okay.
I subspecialize in orthopedics. I love orthopedics. It's the carpentry of the OR.
Ooh, that sounds fancy.
real.
It is fancy.
You're
I
using
like it.
drills and
Drills,
saws.
screws. It's
Ooh, yeah.
the carpentry of the OR. And on top of what Diane was saying, you also have to work in a team atmosphere with a lot of personalities.
Right.
And yes, 15 years has taught me there's a lot of personalities that
yeah.
you have to figure out how to balance during these high stress situations. So
Right.
that's the OR. It's high stress. It's physical. It's emotional. It's a lot, but I love my day job. I come to work every day. I'm pretty happy about it. So
I like that.
yeah.
I mean, for those of us who aren't in an operating room every day, it seems intimidating.
Yes. And I've had a few, I call everyone baby scrub techs, baby surgeons when they're brand new, right out of school.
Right.
We've had a few come through, definitely over my 15 years. And you just kind of look at them and be like, all right, how you feeling today? Did you eat breakfast? Okay, that's a good start. Don't lock your knees. Make sure you had a good breakfast. You just got to run through all of the motions and make sure you're mentally here, you're physically here, you're well, so that you can give all your attention to the patient, to the surgeon who needs you.
Yeah. And these surgeries, like some of them are really long. You just mentioned like, don't lock your knees. Make sure you eat something before you go. Did you potty? I have a 3-year-old. So,
absolutely.
that is, did you potty before you headed in here to scrub up? Like,
yeah. So we're lucky we work at the outpatient surgery center. Most of our cases aren't more than 4 hours because that's what fits our needs. Upstairs in the main OR, 8, 12, up to 24 hours straight going. Like I've done 23-hour shifts on my feet all day, all night.
Same.
Middle of the night. And you're just like
Yeah.
round robbing surgeons. Like, so you have an orthopedic surgeon, ankle fracture. Okay, I'll see you in 6 hours. I have 4 cases in front of you. I have a C-section to do. I have a couple appendixes to take out. I'll see you when I see you.
it sounds so funny because you're not a surgeon, but you are with the surgeons all the time. So you're like, I have this surgery and then I have that surgery. And it's so like, what?
Yes.
And you were in school for 11 months.
11 months.
Yeah, a year. 1 year.
Yeah. Like,
yeah.
It was a lot. So there was 4 tests every morning. First 6 months, you had to get a B or higher. If you got below like an 79 more than 3 times, you're kicked out of the program.
Yeah.
Like you needed to
you
study.
have to know what you're doing.
You have to know what you're doing. This is
Real life.
Is real. This is real
You're
life.
Taking care
This
of people
isn't
who are sick.
silly college classes. This is real classes.
Gotcha.
But the program
Was phenomenal.
Yeah. And I would encourage anybody, if they're interested or even thinking about like, what do I want to do with my life? I don't know, look into it and go to an open house. That's what I did. I went to an open house and I was like intrigued and I'm like, this checks all the boxes.
And it's a great stepping stone. So
Yeah.
if you want to become a surgical tech, you work in the OR for a few years. And Northern Light will attest to this. They have programs out there. Work for us for a few years. We'll send you to nursing school.
Yep.
We'll throw you up the ladder here. Like we'll help you with schooling.
Absolutely. In fact, we'll even help you become a surgical tech in certain situations. We have Earn While You Learn programs to become a surgical tech. We'll pay for you to learn to do
And
that.
everything we learned at tech school would also cover us for surgical cleaning. So SPD.
Okay.
Sterile
processing.
processing, which we also need PSA. So if you like
Yes, we
washing
do.
dishes, come on down.
I like it. I mean, well, and think about it too. Those instruments are so vital. Like,
Yes.
whoa. I mean, you're literally cleaning and sterilizing everything that's needed to help heal people and cut into them and
And that's another part of our job is to make sure that sterile processing went through their steps. So if something's missing or a tray is already contaminated before you even start your case or you open it and you see there's either an indicator missing or
Contaminated of some
a
effect.
hair in it or a pen.
That's
or,
part of our job too. We have to check everything that we touch.
Yeah. Make sure there's no bone in any of the instruments from, past surgeries. Because
Dishwashers miss everything. It's a thing. You just don't think about it in our environment for too long.
yeah.
But we're like the front line to making sure that everything is
Sterile,
Sterile
A-OK,
and
and ready.
I know I look shocked.
you do.
Listeners
just
can't see
like-
my face, but like I'm listening to everything you're saying and I'm like, what?
Her jaw is like a little dropped. And I'm like, ooh, should we rein it in, Diane? Oh, no.
No, don't
real?
rein it in. I love it. This is fascinating. This is one of the reasons I love doing these podcasts is because we learn so much about different careers that we have
You've never heard about.
I have no idea. I mean, I've heard surgical tech, but I don't know what that person does or who that person is. So this is just fascinating, and I kind of want to take us into the operating room. What is, for those of us who don't work in there, we're taken in there and we're asleep. So we don't really know what's going on. What is it like being in the operating room when a surgery of some sort is happening?
So we obviously, like, you'll see your 20 people that will check you in. Well, I'll ask you the same questions 15 times. We all know the answers.
Right.
Just so everybody knows. We do know this. We're doing it for consent reasons. It's one of our like big feedback issues.
Oh,
It's
really?
like, don't you guys know? And we're like, yes, but we'd like to hear it from your mouth.
Yes.
Right.
We like to know that you know
Trust but verify.
Trust
what's
but
going
verify.
on. Yes.
So we'll wheel the patient back. We'll get them onto whatever positioning bed device that we need for that case.
Okay.
Get you strapped in. Anesthesia will take over. And I like to say we don't have a case till anesthesia is happy.
Right.
Right? Patient has to be out, happy, satisfied. And then we'll position. So we need to know where we're working, what we're working on, what positioning devices we need, how to position a patient correctly without hurting them more. And then we have to like open our tables, open all of our disposable goods, all of our sutures, our gowns, our drapes,
The trays.
our trays, make sure those are all set up. And then we have to count stuff with our circulators. While our circulator's doing that, she's off getting meds. She's filling out the whiteboard, doing all the consenting paperwork, checking them in the computer. So there's just like a commotion, but we all have such a part of this team that we all know.
It's a well-oiled machine.
Wow.
Like everybody knows their roles, and we're not afraid to ask for help if we need it.
We're very direct people is what we've been told.
Well, I mean, it makes sense. You have a specific job to do and everything has to be just so. I mean, I'd assume you're all detail oriented people.
Yes.
Okay. Yeah. I'd probably not do very well with that.
Well, we don't ask, oh, can you please pass me the salt and pepper shaker, please?
Exactly.
No, like this. Okay, I need this. And it's not rude. We're just straight
you're
to the
just
point.
doing your
Yes.
job. Yeah.
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 So
And you all know this because you all work together. So it's so funny. Like, I would be like, oh, thank you. Like, but
Yeah.
that's not how you guys work.
No.
I mean, we're nice about it. We're,
Yeah.
if the surgeon hands something back to me, I'm going to say thanks just because, but, and
It's not expected.
Yeah,
like at the
it's
end of the
just-
day,
yeah.
good job. You did a great job. That's really all we get. And that's fine because we don't need the pat on the back. We don't need the thank you every time because we just need to follow and get it done.
Yeah.
Right.
You know?
Yeah. The efficiency.
Yes.
Yeah. I like it. The process, the efficiency, all to help patients. And I think this is really neat and fascinating to hear what you guys do. I mean, I must have had a surgical tech when I went and had my C-section.
Oh, absolutely. You did.
100%.
And I wouldn't have known who to look for to even know who that was.
Nope.
We're usually back to facing the wall, playing with our
We'll
table
turn
of
around and
goods.
say hi when they wheel you in and
Yeah.
they introduce you to us, but a lot of people don't remember us because we're in the background getting things ready. And
And again, it's really stressful time for the patient. We're never expected to be remembered, but we're there for you. We make sure everything comes back out when it goes in.
we are part of the pit crew. And that's one of our little sayings in the OR is when we're getting a patient ready on the table, we're their personal pit crew. We're putting warm blankets on them. We're putting the leg sequentials on so that they have compression on their legs to
Circulation.
keep the circulation going during the procedure. And we're letting them know that we're doing these things as we do them. So, yeah.
She's just jaw dropped.
I am. Well, I mean,
Mesmerized.
I think it's so important for people to hear that because, as you said, we'll get a great job, or we might not even get that, and we'll just keep rolling. So for me, and I'm gonna assume a lot of patients out there. Thank you.
Thank you.
No, seriously,
Yeah.
thank you for all that you do in the background that we don't see and we don't recognize. And an even bigger thank you for continuing to do what you do, even when we don't recognize it. Because that can be hard.
It can be, but we know we do a good job every day. We know we're there for a reason.
Yeah.
We're not going to hold it on any patients, that's for
No.
sure.
I love that. And so, and every day is not sunshine and rainbows.
Right.
No.
This is healthcare. I think it's kind of obvious that it's not like that. You're just doing your best to help patients. Talk to me a little bit about what that's like and how you deal with that and how you manage it.
So physically, we'll go physically first. Physically, you're on your feet for your entire shift. You get a 15-minute morning break if you're fully staffed and functional. and a half an hour lunch break. Otherwise, you're on your feet for your entire shift. So you need to take care of your body.
Right.
So I personally, I make sure I stretch when I get home. I take a nice hot shower. I make sure I go to like a massage like every 2 weeks. I get my back worked out. Because you're holding retractors, you're holding body parts. If you've ever held like dead weight before, it gets pretty heavy, and you're holding it for however long the surgeon tells you to.
Just picture like you're holding a baby, and babies are so small, but you hold that baby for a while, they start to get heavy, right?
Right.
It's like the same concept. If you have to hold a leg up in the air, it's like after a while that leg's getting heavy. You're like, okay. So working out's important. Keeping out, like Megan said, just keep yourself healthy and take care of your body and whatever you got to do. I like to bake. I go home and, if I've had a stressful day, I might whip up a batch of cookies or, like make bread.
And that throws me into the mental state of it all. So obviously high stress means temperature can rise. So the surgeon gets stressed out. They start to get a little edgy attitude to them. We've all had that like snap to us.
Absolutely.
And you just have to just let it roll off your shoulders and give them what they need, and don't take it personal, because it's not. They're frustrated. Something's not going right. And you just have to make sure you're not taking that home with you.
Right.
You have to separate it out of your mind. Be like, I can't believe you handed me this wrong. What are you thinking? You don't. You take a deep breath.
Yeah.
You keep going on. It's very important to make sure that you can stay above that mental anguish. And that's just like a bad surgery. There are bad cases. So cancer is a big one.
Right.
You go in for an unexpected case. We're trying to help diagnose you. We open you up and we just see wall-to-wall cancer. And the whole room just falls silent. And you have to just try to just take a deep breath, get through this case, because you have 4 more cases after this. And you can't let it affect you.
Ugh.
Yeah. So it's not just physical. It's the whole picture. Yeah.
Wow. Ladies, I can't even begin to thank you for giving us this like background look into what you guys do. And I can speak for myself, but I'm going to go ahead and speak for quite a few of our listeners too, I'm sure. And I had no idea all that you guys did as a surgical tech. And while it sounds, there are lots of moments where my jaw did drop. Absolutely. Yeah. It also sounds like you guys love what you do.
I love what I do.
Yes.
I love my day job, and I love being able to say that.
Same. Yeah.
And Northern Light makes it amazing. So I've obviously worked at multiple places in the state of Maine. I've been all over. I love working here. I love the surgeons. Everyone cares so much. And I love our team right now.
Yeah.
It's wonderful.
Okay. Did the other listeners who are possibly thinking of this as a career, even a second career?
I know.
Yeah, Diane, right?
Exactly.
Age is just a number, guys.
Yeah. So, I hope you're hearing this and seeing like, yes, they talked about it. They said what it was really like, but they love it and would encourage other people to come and love it too.
Always. Yeah.
Absolutely.
And just a little plug, if you're interested in an Earn While You Learn program with us, you can email talentacquisition@northernlighthealth.org to find out when the next Earn While You Learn program for certified surgical technologists is, and hopefully take part in that with us and, maybe come work with Megan and Diane.
That's right. Or we could precept you.
Yeah.
Teach you what we know.
Teach you a couple of things.
Teach you a couple things.
Yeah, it sounds like you guys could really teach quite a few things. I like it. Awesome. Well, thank you ladies so much for being on with me today. I really appreciate it. I know you guys have to get back to work, so I won't keep you any longer.
Thank you so much.
Thank you.
Thank you for listening to this episode of Pathways. Please join us next time for a new episode. There are several ways you can tune in on our website at northernlighthealth.org/healthyhappywise. We are also on Apple, YouTube, and Spotify, which makes it easy for you to listen on the go on your favorite app.